Good evening from all of us here at the Not Panicking Yet News Network, and thank you for joining us for tonight's special on respiratory health. We're going to be taking a look today at a virus that has been severely impacting public health for decades, respiratory syncytial virus, or as it's better known, RSV. We're going to take a look at some of its history, its modern day impact, trends in its epidemiology, and exciting forecasts for the progress in vaccination and prevention that we're seeing. Let's begin. RSV is a highly contagious respiratory virus that infects the lungs and breathing passages. In healthy adults, it will typically present with mild cold-like symptoms. However, in infants, older adults, and the immunocompromised, there is an extreme risk of developing more severe disease, such as bronchiolitis or pneumonia. Transmission usually occurs through respiratory droplets or contact with contaminated surfaces. Per the CDC, RSV can survive on a hard surface for up to 6 hours. It has an incubation period of 2 to 8 days, and its contagiousness can range from 3 to 8 days. However, in vulnerable groups, it has been known to last longer. Now to get a perspective from the outside world, we're going to cut to our man in the field, Ryan. Hello everyone that might be tuning in. This is the Network Outdoor Cat here, reporting from the field for reasons beyond my comprehension. What I lack in job satisfaction, I make up for in the facts and the numbers. Such as that in the United States annually, there's 58,000 hospitalizations for RSV in children under 5. And according to the CDC, there's 177,000 hospitalizations and up to nearly 14,000 deaths in adults aged 65 and older. According to WHO, globally, RSV accounts for 33 million cases of lower respiratory infection in children under 5, leading to nearly 3.6 million hospitalizations and 101,000 deaths annually. Traditionally, RSV peaks during the late fall to the early spring. However, post-COVID-19 pandemic, we witnessed out-of-season surges beginning in 2021, and then they peaked during 2022, 2023. It was known as a tripledemic between RSV, COVID-19, and influenza, and it was straining hospitals nationwide. You'll notice on the trend graph here that there's evidence of immunity gaps following the pandemic-era lockdowns and behavior changes that are indicative of these surges. Now, as you can probably tell, I'm rather unfamiliar with crowded settings. However, crowded settings are going to be where RSV tends to thrive. This is going to include daycares, schools, nursing homes, hospitals, and that's going to be due to the transmission pathway of RSV. It's going to be through mostly direct person-to-person contact, contaminated surfaces, and respiratory droplets traveling in the air. Now, tying in with some of these settings is going to be some of the major risk factors and groups that are going to be primarily expected to be exposed and affected by RSV. It's going to be infants under 6 months, adults age 65 and older, individuals with chronic heart and lung disease, people with weakened immune systems. Some other risk factors include prematurity, congenital heart disease, and immunodeficiencies, and all of these are subsequently going to further increase severity risks. Due to network liability, I'm out here in nature, as God intended, and not at a hospital. However, let's discuss hospitalization for RSV by age groups. RSV contributes to nearly 20% of hospitalizations for acute respiratory infections in infants and 15% of respiratory hospitalizations in older adults. Globally, over 2 million disability-adjusted life years are lost annually due to RSV, according to WHO. These disability-adjusted life years reflect early deaths and years lived with disability due to RSV, which is a reflection of the true burden on the health systems. Now, looking at hospitalization rates by race and ethnicity, when examining some disparities, we'll see that Black infants were hospitalized at 1.5 times the rate as white infants, and Hispanic infants at 1.2 times higher rates than white infants, according to the CDC. Looking at social determinants of health, including access to healthcare, crowded housing, and economic inequality, these social determinants will play a major role in these disparities that we're seeing. So, looking geographically, the Southeast and the Midwest saw the earliest and the highest surges of RSV. Rural areas reported higher hospitalization rates due to healthcare access challenges, even though urban areas had higher case numbers overall. Now that we've taken a look at how RSV is hitting us, let's take a look at how we are hitting back at RSV. How's it going, everybody? I am Ryan. I'm here at a BSL 2 level lab that is definitely not located in my basement, and here they do research on respiratory syncytial virus, and I'm here doing some research of my own.
Putting in the man hours to study the science of what you need.
Last week, we put liquid paper on a bee, and it died.
Okay, so how do we fight back against RSV? And to do that, we can take a look at some of the history of the development of the vaccine, which actually started in the 1960s. But unfortunately, the experimental RSV vaccine that came out in the 1960s actually led to disease severity worsening in children, which led to decades and decades of research setback. However, in 2023, there was major historical breakthroughs with the development of GSK's RSV and Pfizer's Abrysvo that were both FDA approved for adults over the age of 60. Maternal vaccination became available, transferring antibodies to the newborns, and Beyfortus, a monoclonal antibody, was approved for infants to prevent RSV during vulnerable first months. So, looking at the clinical effectiveness of the vaccine, GSK's vaccine showed an 82.6 efficacy against lower respiratory infections. Pfizer's vaccine showed us an 85.7 efficacy against medically attended RSV illness. And for infants, the Beyfortus offered 80% protection against RSV hospitalizations. So if we're to take a look at the projections for hospitalizations with versus without the vaccinations, widespread vaccinations are said that they could cut RSV-related hospitalizations by as much as 70% and then as low as 50% over the next decade. Global efforts aim to extend access in low and middle income countries to reduce global mortality. As we were discussing, there's some relations with the socioeconomic factors and determinants of health. Climate change could lead to long RSV seasons, and warmer winters enable prolonged virus circulation. Okay, you don't want to rely on the eggheads in the lab to take care of you, so let's look at some ways that you can protect yourself and others by being a totally independent person. So, you're going to want to get vaccinated if you're eligible. You're going to want to encourage maternal vaccination. As we discussed, that's going to pass along that immunity to the newborn. Great way to take care. 2 birds, 1 stone. All right. You're going to want to wash your hands frequently. As we said, it can spread very easily. You don't want to be a carrier walking around with disgusting hands all day. Wash them regularly. Stay clean. You're going to want to clean surfaces. As we discussed earlier, CDC says they can live on hard surfaces for up to 6 hours, but not if you take care of them. And then, if you're sick, stay home. You don't want to be the office patient zero. Prevention is key, and that is going to probably be the best vaccine, and just making that there's no patients to begin with. Thank you. In closing, respiratory syncytial virus still does remain a critical public health threat. However, thanks to decades of epidemiological research and recent scientific breakthroughs, we now have powerful tools to protect the most vulnerable among us. Stay safe, stay protected. Remember, vaccination saves lives. Thanks for joining us for this epidemiology update on the Not Panicking Yet News Network. I'm Ryan. Stay safe, don't panic yet. We'll see you next time.